Welcome back from the break and welcome now to Healthy Wednesdays. This is where we have a doctor in studio to be able to take us through a few things. Now, this next topic is something very close to so many people's hearts because it translates down to beauty. And over the years, beauty standards, we have seen them, they keep on changing. But the one thing that I believe the doctor and I here that we can agree on, weight and the slim of it has quite been the standard of what beauty is. Or of course, up until Africans started talking about nyash and everything, but at least being slim has always been looked at as the standard for beauty. And in that, we have seen people go through so many things over the years to get slim. We have seen people get into dieting. We have seen medications now. Medications, what we are going to be talking about, working out. We have seen people go with fasting, juicing. There's a lot of things that people have been able to do so that they get to lose weight. And up until 2021, that is when we saw the West come up and our social medias were very, very flooded with something called Ozempic. So today we are talking about that big O. And we have Dr. Colin here, Dr. Karaiga Colin from ADDY Memorial Hospital, which is found in Bahai Road.
Bahai Road,
Yeah.
Plot 1516.
Yeah. Okay, that is where you find Dr. Colin. So glad to have you in the house. Good morning to you.
Good morning to you. How are you?
I'm well. How are you doing? How is ADDY Memorial?
We are okay. We are serving the community we live in. We are found in Kanyanya, and we are very privileged to be here. We will be privileged to partner with you in these various topics. Yeah, and I look forward to a very, very nice
conversation. I am looking forward to it as well. We want to say a huge thank you to ADDY Memorial for walking this journey with us. All the doctors that we've had week after week, there's always something that they get to teach us. Now, we are streaming live on YouTube, so you can be a part of this conversation, but also head over to our WhatsApp line if you need any question whatsoever that the doctor can be able to answer regarding weight loss, regarding Ozempic and the like. But today the discussion is on the big O and the medications, other medications that are there when it comes to weight loss. I am ready. Let's talk about Ozempic. And of course, we have seen celebs, some alleged Kim Kardashian, we have seen Oprah herself, we have seen Elon Musk. So many have come out. Others have been speculated, and some have confirmed that they have used Ozempic. What is Ozempic?
Okay. Ozempic is a certain medication that is classed. Medications are usually classed by what they do and how they act.
Okay.
So what Ozempic is a medication that is called a GLP-1 receptor agonist. What is GLP-1? GLP-1 is glucagon-like peptide receptor 1 agonist. So it means that this medicine basically goes in this receptor where this glucagon-like peptide is supposed to go and cause similar effects.
Okay.
But in order to understand Ozempic and why and how it works, you need to understand where it came from. Ozempic is one of those medicines which were designed for a certain purpose, and then people reported a certain side effect profile, which the company then recalibrated towards. Another one is, for example, Viagra, sildenafil. It was developed for pulmonary hypertension, but the side effects were that it gave people better and longer erections, and then the company went that way.
Wait, for real?
Yes. So
I have learned something new. Okay.
So now Ozempic was developed for diabetics. And it was developed for diabetics, and then while they were doing the research for diabetes and everything, they found out that many people who started it also lost weight. Why? This Ozempic like I've said, when you have diabetes, maybe I can just give a bit of a preamble. When you have diabetes, you have a problem with your insulin. Insulin is a hormone which basically regulates how much sugar you have in your blood.
Okay.
So when you have diabetes, you have a problem with insulin. Either you don't have insulin at all, or you have insulin but your body is resisting it. Usually the cause of the resistance is fat. So type 1 diabetes is when you don't have insulin at all, and this usually happens, is diagnosed earlier, like in childhood, those children. And what usually happens is that it's an autoimmune process where your body rebels against itself and eats up the cells in the pancreas
to attack it.
that produce insulin. So for those people, you realize that for them, they start on insulin shots earlier on.
Yes.
Type 2 diabetes develops over a period of time, and there are things that influence it, including genetics, including lifestyle, including even race. Certain races, for example, the Indian race, have much higher rates of diabetes than in type 2 diabetes than in other populations. Okay. So now, when they were among the things which they discovered as they were doing this research, they realized that, for example, when someone ate an oral meal and they tested their insulin levels, when a diabetic ate an oral meal and tested their insulin levels, they were much higher than when they were given an IV of dextrose. So that led doctors to start asking themselves, but is there something in the gastrointestinal system, in the gut, that causes more insulin to be released? And when they did research, they realized that the gut produces that glucagon-like peptide 1, that hormone. It produces it in the small intestine, and that hormone then acts on the pancreas to release insulin, which insulin then goes to the blood and causes glucose to be released, it causes glucose to be used in the muscles, to be stored in the liver and different places. But the other effects that this hormone has, importantly for our conversation, is that this hormone also reduces the rate at which your stomach empties and the rate at which your gut is moving. Meaning, this causes two things, meaning that you feel full more for longer, and also meaning that because you're feeling full for longer, you're likely to eat smaller meals.
Yes.
But it also goes and acts on your brain, in the brainstem somewhere, and it causes you to feel more satisfied and to lose appetite. Yes.
So we are still talking about the research, not the medical. We are still seeing what they found in the small intestine.
Now we're still talking about how they started this whole thing. So now, the thing with this hormone is that normally the one the body produces, it acts for 1 to 2 minutes. So they were saying, what if we had this hormone act for longer? So they produced a GPA1 receptor agonist, which is the Ozempic. They're actually called, they have a certain technical name, I'm just forgetting, but they produced that, and then for it now acts on both on the diabetes, and then they found it causes weight loss. Now when they found it causes weight loss, the Ozempic is a certain dosage and dosage percentage, of course. So the company which makes it then shifted, and then they produced what we call Wegovy, which is like a higher dose, which is just strictly for obese patients.
Okay. Now, let us first go back. So when we look at Ozempic, was it made to treat type 1 diabetes?
Type 2.
Type 2.
Type 2 diabetes, because like I said, with type 1, you're not producing any insulin at all. Now with type 2, you're producing but for some reason you have insulin resistance, you have other things. So because of that, we now say, if we give something that activates your body to produce more insulin, activates your body in certain ways, and also because part of what causes type 2 diabetes is is having high cholesterol levels. So
it helps that
yeah,
you're actually losing
you need
weight.
to lose weight.
Yeah.
Actually brings your diabetes, what we call glycemic control. It brings you back to a level where we can manage. So that's why it was started. Ozempic itself,
Yes.
actually, according to the Food and Drug Administration Food and Drug Agency in the States, Ozempic itself is a diabetic drug.
Okay.
The drug which they approved for treatment of obesity is called Wegovy, and they are the same. The active ingredient is the same, but for Wegovy, what happens is that has a higher percentage of the active ingredient.
Okay.
Yeah. So
Okay, so now so does that mean, because initially when we first heard about it, that was, I believe, 2 years ago, when now it started becoming popular, people without diabetes were going for it because they wanted to lose weight.
Yeah.
So does this mean that these producers, they made Wegovy so that the person without diabetes but wants the same effect can tap into that without necessarily taking Ozempic?
I think what they did is that they needed a shift, and they needed to know, because for these medicines, what you need to know, it's why you see that and it's something about medicines, why you see for children we usually have syrups, for adults, for people who are 12, we have certain milligrams and dosages.
Yes.
And all that is research based, very heavy research. So when you want to shift something, if something is strictly to control someone's sugars, but now you've seen a side effect which you like, that now it can also help bring someone's weight within a certain range. When you're to shift there, you have to do research, and then you find out what should we use, how much should we use.
Okay.
You understand? How much can achieve our goal. So that's why research then shifted towards this side. But Ozempic is still used as a drug for treatment of diabetes, certain types of diabetes.
Okay.
And on top of that, but what I need to put there is that if you look at what the criteria for using Ozempic is, according to the FDA, they will tell you that you use it in conjunction with other diabetes drugs. Understand? If you're using it for treatment of diabetes, for obesity, they will tell you that certain people also qualify for the use of Ozempic or Wegovy. So they'll tell you that someone who has a BMI, body mass index, of over 30, we calculate the BMI by getting your weight in kilograms divided by your height in meters squared.
Okay.
And we get a certain figure. So if we get between 18 and 24, we consider you normal. 25 to 30, we consider you overweight, and anything over 30, you're obese. If you get over 40, you're morbidly obese, which means that the obesity is a disease
in itself.
So people with over 30, or people who have a BMI of 27 but have an underlying medical condition that their weight makes worse, they are the ones who would qualify, medically speaking.
Yes.
But of course, some doctors and I think some patients, for various reasons, would find ways of justifying taking the Ozempic.
Okay. Now, you are telling me some other medications that people are taking. What other medications are in that line of that people are taking them for?
So the common ones are Ozempic, Wegovy, and Mounjaro. Mounjaro is also the same thing. They are all in that same category. They are glucagon-like peptide receptor 1 agonists. They all act in the same way. Yeah, they all act in the same way. There are two hormones there, but it gets a bit technical. There are things which you have to really understand. But what I can say is that whether it's Ozempic, whether Mounjaro, whether you're using any Wegovy or any of the others, they are over 9 molecules. But the most common ones are Ozempic and Wegovy and Mounjaro.
Yeah.
And the others are not so common. Why? The method of administration. These ones you need a shot every week. These others you might need a shot twice a day, so they are not so popular with people.
Yeah.
Twice a day. One of them is oral, but again, it is not that popular. Yeah. So that's why these ones came out to be
very popular.
very popular.
Now, speaking of popularity, again, these medications are looked at as the cool things that cool people are doing, because first of all, they are not cheap. Yeah, they are really not cheap.
Actually, Ozempic, a month's dose is upwards of 1,000 USD.
I beg your pardon?
Yeah.
Whoa, so these people
That's why
actually
I think in popular culture they are used to flex, because
Yeah.
someone thinks if I'm spending $1,000 to look like I am, I must tell somebody, who must tell somebody to tell somebody.
Exactly. So, how did we get it to being a popular thing, and do you think this is a good thing? You can probably comment on that before we go for a short break, and then we'll come back to talk about side effects and the like. But let's talk about the popularity bit a little. Where is this coming from?
Number one, if you look at the people who first started the conversation in the mainstream about Ozempic and others, they are celebrities.
Yes.
And we know that in this world with social media and all the others, they're now,
those are the influencers.
Those are the people who influence people, and they want to find out, and people will get curious, and then they'll start a conversation. Oh, I know Stella is on Ozempic and all that, and then everyone will want to ask Stella, are you actually on Ozempic? You see, so it starts this whole thing and the curiosity, and then people want to try it out. You see some others. I've seen YouTube videos where someone does chronicles of their Ozempic journey and all that. So you create a lot is created there. But from a medical perspective, these are medicines like any other. And there are criteria for using this medicine. And a lot of that criteria for us from a medical perspective is, number one, is someone actually going to benefit from the Ozempic? Do they need it? Are they diabetic? Are they obese? Are they at risk of getting the diabetes? Do we have other options? And for me, I usually go back to the lifestyle modification options, which is modification of your diet and exercise. Have you tried it? Because if you came and you wanted a prescription, I'd ask you, have you tried that? You see, and you'll find maybe someone has genuinely tried that and it's not working, or someone has been on oral hypoglycemics, the medicines that we use for diabetes, consistently, and they've modified their diet, they've done their exercise, but they just have that extra bit to get them healthy.
That is not,
so that's when you might decide that, you know what, let me give a prescription for this. And you give a prescription for a certain amount of time.
Okay.
Yeah.
All right, we have to go for a short break right now, but get the questions in case you have any, and also get yourself a cup of coffee, because the conversation is still going here with Dr. Colin, so please do not go away.